Advances in smart pump technology can improve patient safety and provide efficiencies in nursing care delivery. In this session, learn more about advances in technology that can help you work smarter, reduce errors, and better protect your patients. I'm Lily Jelinas, Editor-in-Chief of American Nurse Journal and your moderator for today's session. I'd like to introduce you to our panel. Susan Niemeyer is Chief Nursing Officer and Vice President for Clinical Excellence at Fresenius Kabi, and Brittany Sowers is Professional Development and Practice Specialist at San Luis Medical Center. Our objectives for today are discuss current smart infusion pump capabilities, discuss benefits and current challenges in the use of smart pumps, and describe innovations in technology that can improve safety, workflow, and usability while eliminating error-prone manual tasks. Before I turn it over to Susan, just to let you know that you can type your questions into the Q&A box at any time during this webinar. So I'd like to turn it over to Susan. Welcome, Susan.
Thank you. I'm excited to speak with you today on infusion pump technology. Now, there is an ocean of material out there. And the last time I checked, and if you Google smart infusion pumps, you'll find almost 2 million results. So where do you start? And what's most relevant in today's digital and workforce-strapped environment? So we hope to provide a little clarity today. So we'll talk specifically about the current state of infusion pumps. We call them legacy pumps. They've been around for 20, maybe 30 years. And we'll talk about some of the safety concerns still plaguing the industry. In the second half of this webinar, we'll look at advanced infusion pump technology, what we may call as the next generation of infusion pumps, and how they aim to impact safety, efficiency, and usability. So it's a really big topic today. We hope you walk away from today's session with something new, something interesting. At least we'll infuse you with knowledge. We hope you at least have a greater appreciation of the subject. And speaking of infuse, IV pumps are among the most frequently used devices in healthcare, with an estimated 9 out of 10 patients receiving an IV medication during their hospital stay. Now, the traditional infusion pump was the first programmable IV pump with the capability to program a specific rate and a volume. So it provided just basic capabilities. And if you look at this list right here, it was not a lot. You know, an infusion rate of 0.1 to 999, some basic features like pause and standby, and very few alarms. And, you know, you may actually remember using one of these traditional pumps if you're a certain generation. I know I did. We also know they kind of got pulled out of the kind of closets and warehouse during the pandemic. So you may have experienced them then. And these pumps were truly the kind of the workforce of infusion therapy for many years, and really helped kind of really springboard us to next, which was smart infusion pumps. So smart infusion pumps were actually conceived in 1992 by Dr. Nat Sims at Mass General. And shortly after, drug libraries were introduced into the pumps that helped provide nurses the technology to deliver really highly complex therapies. And then in 2002, these pumps were first introduced and described by the Institute for Safe Medication Practices, ISMP. So really, what makes it smart? So these pumps include a customizable drug library with dose error reduction software, DERS as we call it. It's the safety software. And that allows the nurse to choose a desired medication from an approved list. And then the pump does the calculation of the rate or the dose rate for the nurse. Now, the safety software alerts the nurse if the calculated rate exceeds the acceptable dose limits. And so it also provides kind of a wealth of data, often seen in CQI reports, to help analyze drug library use. Now, smart pumps have been indispensable in the administration of meds and fluids and even blood. And so they help reduce the administration errors associated with miscalculated doses. They provide a check of the calculation, ensure that the dose selected is appropriate, and they allow nurses to recognize the programming errors and miscalculated doses through these alerts and stops in that safety software. So they would have otherwise caused patient harm, so they actually stop that. And as mentioned, they provide data on how the nurse actually programs the pump, and they provide an analysis of the information to help guide quality improvement efforts. But are smart pumps really that smart? So the data indicates that the use of IV smart pumps has reduced IV medication errors. However, the errors have not fully been eliminated. Now, the literature review shows the use of IV smart pumps has not had a measurable impact on decreasing adverse drug events. And some of the issues you see here are why they haven't decreased those ADEs. The drug library has been bypassed. The hard and soft alerts are problematic. There's no assurance to the 5 rights, right drug, right dose, right route, right patient, and right time, etc. So there are continued problems with the smart pumps today. Now, researchers at UMass Amherst, including Dr. Karen Giuliano and Dr. Janine Blank, among others, are doing incredible work in studying pumps and investigating errors with the current legacy pumps out there. Now, according to these researchers, common sources of errors include bypassing the drug library and programming errors. So if you look to your left, and if you remember, the drug libraries intends to provide a list of drugs in a specific care profile. And when we say care profile, that means you're in the critical care profile, so you can only deliver drugs that are appropriately for critical care or med-surg, drugs in that area, etc. And then also the drug library should be doing these dose calculations for the nurse. And if the nurse is bypassing that, that's essentially, we call it the Wild West. They're going back to those traditional pumps with none of the safety software applied. And why they often bypass the drug library is just the complexity of the user interface, that UI on the pump, and the time it actually is required to program the drug, and the fact that the drug library may simply be incomplete. And we know during COVID or during certain times, there is a back order of drugs, or there's a short supply. And if you're trying to use the drug library and it's not there based on the order, that really creates a lot of confusion. And that's often the reason why many nurses bypass that safety software and the drug library on the pump. Now, if you look to your right, the programming errors can result from actually incorrectly entering or selecting a drug, a dose, a calculation, a rate, and a time. It's a manual process, and it can sometimes be very confusing because you're using these outdated menus, these complex kind of user interfaces. And then clinicians in busy nursing units are frequently interrupted and rushed during programming. Who isn't? And they often override those alerts, and they program the drug outside of the safety software just because they're strapped for time and they have a lot of competing work demands. And that's part of their daily practice. So this is some of the issues on why there are continued programming errors. So let's look at kind of the usability issues. Now, programming a smart pump requires a high level of cognitive demand because there are many steps the nurses are required to do. And the nurses are often seen as that shock absorber between the device and the patient. And they're taking on all of this kind of this burden. And so we know this high cognitive demand compromises a nurse's ability to provide safe patient care. And some of the usability the nurses report actually include that the key or the menus and the key selections is terribly confusing. There's a lot of screens. They're giving every option available. And if you press something and it's not correct, it may provide an alarm, and the alarm is a code, and then you need a decoder ring to understand what that alarm means. So it's really not intuitive and clear about what is happening, where you are in that workflow. There's also the problem with kind of numeric keypads. So if you want to program something like heparin, here we are, let's go back almost 20 years to those numeric phones that we had to text on. And if you were going to text on heparin, you would press 4 for H, and then E would have been a 3, and then you go to the P, which would have been a 7. So you get the point. Talk about cumbersome and frustrating. And there's also, the use of kind of these outdated menus that have the arrow up and arrow down, and it just takes forever to get through the programming. So something that could have taken maybe 5 steps takes 25 steps because you're using all of the arrowing up and down. Also, with the usability, the screen displays are frequently small. So you have to come very close to the pump to program it, or they may be black and white. So if you're in a dimly lit room, it can be very challenging to see. And then following, also, there are continued issues with the device being really too big. I mean, some of these IV pumps are over 30 pounds. And we're always worried about kind of back injuries and harm to us as clinicians, or they're too small and, they're hard to manage. Think about it back to the phone analogy. The flip phones seem to get smaller and smaller and smaller until they were really hard to kind of really use until the smartphones came out. And then they had this big bright screens and they were a little bit more comfortable. The form factor in the hands seem to make more sense. Now, in all of this usability, I haven't even mentioned those excess alarms, which can lead to fatigue, which is another source of stress for the nurse. And all of these issues can be exacerbated in the critical care units like ICU, where nurses experience even more high cognitive drain, and the pump use is especially high, especially when you have multiple pumps compared with the patient. And so all of this kind of leads us to why advanced technology is needed. Number one, to kind of lower the complexity, to lower the cognitive demand, to lower the potential for contributing to medication errors. So next, actually, let's talk about secondary infusions. And so secondary infusions, or IV piggybacks, are the most common method of administering medications that are one-time use or intermittents. And these are often IV antibiotics or electrolytes or chemotherapy drugs. And many smart IV pumps, especially those that are linear peristaltic pumps, and those are the ones that have the rollers over the tubing or squeeze the tubing. From our nursing fundamentals what peristaltic means, squeezing. Well, they actually require really specific setups to ensure that the flow is accurate. And nurses' knowledge of the setup is quite low. As a matter of fact, the pump actually requires you, with these linear peristaltic ones, require you to set up the pump the height of the patient's vascular access site, or the heart. And less than 15% of nurses know that you have to set the pump up at the level of the heart. Also, the pump's IV bag height relative to the IV pump. So where's the first primary bag? And then the height difference between the primary and the secondary IV bags. Now, less than 5% of nurses know why you're hanging bags of your primary and your secondary differently, and using those bag hooks. So if the height difference between the primary and the secondary is not enough, the secondary, or that piggyback, may not infuse. Or if you fail to unclamp the secondary tubing, you'll have, the delivery of the primary bag instead of the secondary bag. Who hasn't done that? If you hang the bags at the same level, you may have concurrent flow. And then when you do that, it's at a very much an unpredictable rate. And then finally, there can be residual medication left in the IV bag, that secondary IV bag. So and sometimes 20, maybe 30% of that really critical antibiotic is left in the bag, often resulting in an underdose. So how many nurses listening to this webinar have encountered these issues? And I would presume the majority have. And again, less than 5% of nurses understand why you need to hang bags in this manner for those linear peristaltic pumps. Now, if you fail to adhere to this very specific setup, all this may lead to a very dangerous medication errors and deviations in flow of what was programmed on the pump and what was actually delivered to the patient. Now, these medications are rarely reported, and the need of height differences, meaning the location of the pump to the patient and the location of the bags, and the lack of standardization of training and education regarding the reasons why you do this, and this high cognitive load all contribute to increased errors with secondary medication administration. Now, as mentioned, this is very complex and it's highly error prone. And here you actually see that the adherence to the required setup is often not even possible in the clinical setting because of space limitations, height limitations of just the nurse themselves, and kind of the workflow and patient needs. Now, ISMP in their latest guideline recommended that the delivery of secondary infusions do not require height of the bags. And so if we review that guidelines, it's a really it's a wealth of information about what the next generation of infusion pumps should operate, really to kind of help alleviate nurses, but more importantly, to be much more safer for our patients out there. Now, healthcare was forever changed after the Redonda Vault case, the former nurse criminally prosecuted for a fatal drug error in 2017. Now, this case gripped all nurses across the country and set a dangerous precedent of criminalizing the honest mistake and the fact that she had reported this mistake. Now, the nursing profession is already extremely short-staffed, and this strain is causing immense pressure on nurses. We need to look at a more effective mechanism, bleeding edge technology to help support nurses. And we want to make sure that we give them the right tools. And when I say tools, it's not something to add to our existing tool belt, but something that's really invisible to us, but it's working in our favor to start taking away some of these tasks and that burden and the steps of managing technology. And let's have the technology work for the nurse. And so that leads me to the second half of our webinar, and really the need to make things better for nurses. So let's talk a little bit about advanced infusion pump technology. So we know the acceptance of the status quo has really gone on too long. And actually, It's no longer acceptable based on our current situation and our workforce shortages and the severity and the complexity of our patients today. In an era where there is disruptive technology impacting every aspect of our life, from smart homes to smart watches to smartphones, infusion pumps built on this old legacy technology are negatively impacting us every day, and we need to think differently. So to move the needle on IV-related medication, there is a substantial opportunity for hospitals to adopt kind of the advanced infusion pump technology, really based on that next generation platform that helps us improve the medication process, our clinical outcomes, reducing that cognitive burden, and ultimately improving patient safety. So if you look at future pumps out there, I'd like for you to keep in mind these 3 pillars: simplify, automate, and informed. To simplify, you want everything about the pump to be simple. And that's not easy because this is a complex medical device. Simple UI, take the nurse out of the mechanics, make the pump just work for the nurse. With automate, you want to automate those steps that are often manual, and because they're manual, they're error prone. And then finally, you inform care. You empower us with the right information at the right time to make those right decisions, and we'll be just much more satisfied in the delivery of medications by using that technology. All of this contributes to reduced IV medication errors, and again, much more satisfied nurses. So before we go deeper into these pillars, we should actually recognize that the FDA also wants pumps to be cleared in this way. So having safety features that make it easy for the nurse to do the right thing, meaning it needs to have usability and human factors kind of throughout the workflow. And it's really kind of shocking today that pumps cleared prior to 2014 didn't have this requirement, usability. And so the FDA is really trying to kind of is forcing pump manufacturers to weave this in and have evidence that the usability is straightforward. It is very clear and simple to use. So let's go back to that pillar of simplicity. So today's technically advanced pump should reduce complexity in administering medications. They are designed with a very intuitive smartphone, a phone that we are all familiar with. We know this technology. So they have a smartphone-like user interface that guides the nurse through the workflow, especially those complex medications like bullets or weight-based drugs or drugs that you don't deliver every single day. So it's going to only give you options relevant to that workflow. And that keeps you kind of zeroed into the task at hand. And as I said, it has a smartphone-like user interface. It's bright, it's touchscreen, it's readable from the doorway when you want to do a quick assessment, really without disrupting the patient. So again, think of that from a simplicity, bright screen, easy to work through, very intuitive, few steps. To continue on the pillar of simplification, so nurses should not be forced to manage a complicated setup or tinker with an infusion pump that's often disruptive, period. So the next generation infusion pump does not rely on the position of the pump to the patient's vascular access site, their heart, or the height of the IV bags to ensure accurate delivery. And the use of those really clumsy bag hangers to deliver a secondary infusion just simply go away. The pump also informs the nurse when flow is obstructed on a secondary line, such as a closed roller clamp, and in doing so, it avoids any delay of therapy. And the pump delivers the entire secondary, likely switches back to the primary, ensuring the entire prescribed therapy is delivered. Again, making this all easy for the nurse. A systems approach for infusion pump and tubing is that the primary and the loading of the tubing in an advanced pump should be easy. I say it as easy as inserting a credit card into a reader. So you should not require a nurse to thread IV tubing through these very narrow channels, close little clips, close the door. Take that all away from the nurse. Actually, just make them as easy as that credit card into a reader. And the tubing and the pump should work in harmony. So the pump should recognize the type of tubing that's loaded into the pump. It should provide kind of workflow guidance based on the type of tubing. So if you actually put blood tubing into pump, it actually helps you deliver blood. All of this really creating these safety checks along the way. And this, along with the design of the tubing itself, helps protect against free flow conditions, and this is always a continued cause for patient harm. So, the newest, most advanced infusion pumps should be designed to not even allow free flow to occur. Next is about time, and time is one of nurses' most valued assets. And the next generation infusion pump should decrease programming time. I want to say decrease programming time, because if you decrease time, you reduce the chance of interruption, which is when mistakes happen. And also, if you reduce the time, that reduces the likelihood that the nurse will bypass the safety software due to kind of frustration or constraints. So when you look at the next, your next infusion pump, really put this in play and really look at it from a time perspective to ensure that nurses are doing the right thing and unlikely to cause errors along the way. Next, let's go into our second pillar, which is to automate. Remember, automate is removing those manual and therefore often error-prone steps. Now, we mentioned the drug library from before and how nurses often bypass the drug library, that safety software. But with the kind of the advanced infusion pump, it should actually just default to the drug library. You shouldn't have to search for it. It should just be there as the starting screen when you program the pump. And it should be so easy to use the drug library, you don't even want to bypass. Also, the drug library should always be updated on those pumps. And so in the drug library, when I say update it, you shouldn't have multiple drug libraries in place at the hospital that could cause errors. And second, you want to make sure that updates to the drug library are completely invisible to the nurse. So you don't want them accepting it and then rebooting the pump. That's unacceptable. You want it to happen just naturally, and you're operating the pump and bloop, the drug library is updated. Now, if you go down the stream of automation, the advanced pump should also sense when that downstream tubing is occluded. So it should recover when the obstruction is resolved. If the pump has a locking feature, remember that touch screen, that once you unlock it, your PIN is paired with your care profile. And remember that care profile is either your critical care or med surge. So once you unlock it, you're already in the right care profile. Remember, you're taking away all those steps for the nurse with this type of capability, and you're actually removing the potential of an incorrect selection. So again, just making it easy from an automation perspective. In the line with, automation, nurses should not be spending time on the mechanics of setting up an infusion. We are often seen as the bridge or that shock absorber between the device and the pump, or the device and the patient. And actually, we should just throw that away. The pump should just work. So the next generation pump should actually measure fluid and automatically adjust to make sure the fluid and the delivery is smooth and it's accurate under all real-world clinical conditions. And when I say that is, you don't need to kind of place the pumps at a certain height on the IV pump. You don't need to kind of contend with the bag heights. You don't have to worry about fluid viscosity, because the thicker the fluid, it takes longer to deliver. The pump should actually just recognize that and really push harder to deliver that to the patient. And the pump should actually recognize the type of IV tubing or the catheter size. So no matter the small bore tubing, or if it's a PICC line or central line, it should just accommodate based on those sizes and deliver the drug as what's programmed on the pump. And as mentioned, it should deliver the entire drug on the secondary, reducing the potential for subtherapeutic delivery, which could lead in some instances, especially for those antibiotics, any kind of antibiotic resistance. The holy grail is to integrate pumps to the EMR, and integrating meaning that the pump and the EMR are essentially listening and talking to each other. We call it bidirectional. So they do this wirelessly. And in doing so, it allows the pump to be programmed from the orders, and enables all that medication data, once it's programmed, to automatically document in the patient's record. Think of it, it takes you away from that burden of documenting or the burden of manually programming the pump. So, and in doing so, the next generation infusion pumps ensures that the least amount of effort should be in place to implement smart pump interoperability. We want to shorten those adoption times. We want to communicate directly to the EMR, making it easier to build interoperability and to maintain. And again, remember, once those orders are transmitted to the pump, because we already do barcode meds administration, we scan the wristband, we scan the drug. This time you just scan the pump, the orders appear on the pump, it's already automatically programmed for the nurse, and all you have to do is start. So it takes away time and the potential for those errors, because it's a manual step. But again, it sends accurate and time-stamped infusion data to the patient's record, reducing kind of that documentation time and any potential for transcription errors or omission errors. How many times did you go home at the end of your day and remember that you forgot to document something? So this actually does the documentation for you, really creating an immense amount of benefit to the nurse. And also the third pillar here, informing decision. So the next generation pump, those advanced infusion pump technology, improves safeguards like identifying incompatible drugs or duplicate drugs, helping the nurse know the potential issues. In addition, it has real-time feedback about what was programmed outside the values. So it empowers the nurse with the right information at the right time to make sure they're not contributing to any medication errors. And as you see here, you know exactly what's happening and you have the information to respond appropriately. You should also provide some remote viewing. Nurses can see from afar what's occurring at the bedside. So they should see it on a tablet, on a phone, on a laptop, when the bags are almost done, any condition of an alarm going off, especially in those rooms in which the patient is in isolation. This gives you the right information before entering the room. And I see this as a win-win for both you as a nurse as well as the patient. And then finally, kind of the innovative advanced infusion pump provides prompts and notifications to kind of help guide on those really complex programming. So it aims to reduce those nuisance alarms and thus help those annoying noise that we often are desensitized to. And it sends all that data to alarm management systems to help prioritize the alarm. It sends it to, can send it to another person, helping reducing that fatigue and, of course, that patient dissatisfaction. As you look to technology to help solve problems, recognize that advanced infusion pump technology has the promise to solve ongoing medication errors and optimize efficiencies, all leading to patient safety. The definition of insanity is doing the same thing over and over again and expecting different results. And I challenge you to think different and to seek out the latest generation of infusion pumps that make it easy for you and your patients. I'd like to hand this off to my professional colleague, Brittany Sowers, who can describe how they recently deployed this technology. Brittany, off to you.
Thank you. So I'm the Professional Development and Practice Specialist at San Luis Valley Health. We were recently able to make the transition to a new pump system, which was awesome for us. And I want to talk to you a little bit about that journey. First, I want to talk to you about kind of who we are. So we're located in Alamosa, Colorado. We're a small rural facility, only 49 beds. When we started looking at what pumps we wanted to upgrade to, we really wanted to focus on safety and quality and what that would mean for our patients and our nurses who are at the bedside. So with that, we wanted to make sure that any pump that we chose and implemented across our organization had the capability of a really good drug library, was super user-friendly and interactive for the nurses, and decreased the workflow for our nurses, really so that it gives them time back to their patients. So we looked at all sorts of different pumps. We decided to go with the newest generation of pumps, and we were very happy to be able to do that. So with that, not all infusion pumps, of course, are alike. When evaluating the infusion pumps, it's important that safety is the focus and to discriminate between the legacy and the next generation pumps to make sure that you're getting really what you need. By using the advanced infusion pump technology, nurses are more confident. They spend less time programming. They spend less time worrying about drug errors and chasing those new alarms that we don't like. They're able to stay zeroed in on their patients. And furthermore, the technology advances medication safety by seamlessly adhering to the 5 rights, especially when documentation is included. And as shared, there are numerous capabilities of the advanced infusion pump that can improve the medication delivery process, clinical outcomes, and ultimately patient safety. And we were so happy to be able to go through the journey of looking at all the different pumps and really getting to invest in the newer generation of pumps. So the nurses are happier with these pumps. They're easy to use. The workflow is easy to use. Like many organizations, we have lots of travel nursing coming in, new graduate nursing coming in. And one of the things that they really enjoy about the pumps is they're easy to pull up that workflow. They're easy to integrate with the technology. The buttons are easy to see, and they know exactly what their patient is getting. And I will give it back over to Dr. G.
Thank you, Susan and Brittany. We really appreciate your insights. And now we'd like to hear from you. Type in your questions in the Q&A box. We have our first question, and Susan, I think it will be for you. Modern electronics are much less costly than previous generations. Is that true with modern infusion pumps?
You know, that's a really great question. And I do believe that, you know, if you have a brand new or the next generation infusion pump out there in the market, you have to be cost competitive and you have to continue to kind of reduce the cost of ownership. I think that's critical for any device that's deployed in any U.S. hospital today. So yes, I would presume that the next generation pumps are you know, keeping cost in mind, and critical that you do ask those questions to any pump manufacturer out there to ensure that costs are again, you're keeping the fact that every element of the pump and the features and the workflow safety kind of point to reduction of, of cost overall.
Thank you. Brittany, this was probably for you. What pumps did you use previously before your transition?
That's a good question. We used the plum pumps previously. They were quite old.
Quite old. Sue, perhaps to you, what is your market penetration with this technology?
Yeah, I think next generation infusion pumps were just recently released, so they're slowly but surely gaining market traction. So I don't have the exact numbers at my fingertip, but I would expect that they'll start hitting kind of the market analysis that you often see with either ECRI or CLASS, and you'll be reading about those. I'm sure this year, if not, they just are recently were deployed. So I think it's an exciting time for the technology to get more and more into more and more hospitals.
And the patient safety aspects are so important as well. Brittany, probably back to you. How long did your implementation take for San Luis Valley?
It went fairly quick. So from deciding on which pump we were going to get and getting that purchase order through, the biggest part was working with pharmacy and nursing to build the drug library to make sure that we had the tools at our fingertips so that when we went live with the pumps, they were ready to go. And then the education went fairly quick. We were able to do live education for everyone, and then within a week, in about half a day, we were able to deploy the whole fleet.
So Brittany, one of the clarifying questions here is, how were the nurses trained to use the new pump? Can you explain your process? Not just how long it took, but education and training can be costly. We're taking staff out of the normal staffing rotation. How did you accomplish it?
Yeah, so we went at a kind of a multi-pronged approach. We worked with the company to upload SCORM files into our learning management system. So our employees had kind of that background knowledge right away. They were able to go in, log into their learning, go through and see what the pump was going to be about. There was interactive buttons with that, so they could kind of play with it in a virtual setting. And then we had a huge skills fair, and we brought everybody in to sit down and have a hands-on training that was about an hour long with the company people who were amazing and wonderful. And that went really beautifully to have all those people get that hands-on training and be able to ask real-time questions and get them answered right away. And then within a week's time, we had the pumps out and on the floor for everyone to use.
It sounds really efficient. Brittany, are the pumps being used throughout the hospital? Does anesthesia use them, for instance?
Our pumps are used throughout the hospital. Our anesthesia group, they do use the pump a little bit. They have one. They generally still like to push their own meds and use one of those syringe pumps, but they really do like the new pump. We're starting to get them on board with using it more and more.
Great. Brittany, have you been able to create a return on investment number yet on your savings? This question is very specific on how much savings by getting infusion to empty, no doses delayed.
Yeah, it's still really early in our investment to have that good return. We know that nurses are spending less time having to manually calculate out drugs, and we know that our efficiency of getting the pumps programmed faster, we can see that return instantaneously, but to put a number on that is hard.
Right now, I'm sure it's hard, and the quantitative is one thing, but the qualitative impact, the satisfaction of the staff, and the impact on patient care is sometimes a little harder to calculate over time. But I know you've already talked about how important that is. So because we keep talking about this term interoperability, can you explain that term and what it means, including auto programming and documentation?
Sure thing. So interoperability is essentially the ability of the pump and the electronic record to essentially listen and talk to each other wirelessly. So this communication between the pump and the EMR allows the pumps to be programmed from a provider's order. And when it's programmed, there's a lot of benefits. It reduces that time, and that, we're all conscious of time. So no more time consuming, and it's often error prone when you manually program an infusion pump. To automate that just kind of takes that all away. And again, it's from those providers' orders. In addition, all that data goes and flows into the patient's record. And so I don't think any nurse here loves to document. I know I did not, but it really does the documentation for him or her. And so it kind of eliminates the transcription errors or admission errors. I don't think any nurses, we all had those experiences in which we get home at the end of a long 12-hour shift and remember that we forgot to document something. So it takes care of it for us. So great benefits in both sides.
Sounds like it. And Brittany, it sounds like you've had tremendous experience. The staff has had a great experience with the new pumps that were implemented. Here's a great question. Besides integrating to your electronic medical record, do you also have notifications sent out to mobile communication devices?
Not yet at this time. We're still working towards integration, so we haven't gotten there yet.
So have you used some of the integration features of the pump, or you're still working on that, just to be clear?
In a way we do. So we do have the patient list pull into the pump, but we don't have that documentation pull over yet.
Here's another great question. As you know, especially with the pandemic, there has been an exponential use of travel nurses, and this question relates to somewhat of that. Has San Luis Valley taken advantage of the resource library to help new nurses and travel nurses with the ability to have drug information and protocols right on the pump?
That is a great question. And yes, it is really nice to be able to be working with the pump and have that information right there. And with our travel nurses, since the pumps are so intuitive, and we do have a lot of that, travel nurse incoming and outgoing, their feedback we've gotten from them is it's just so easy to use. Like, they can get into it and it just it's easy to navigate.
Great. Brittany, it looks like there's a question. What is the pump manufacturer name that you purchased?
Ivanx by Fresenius Kabi.
Ivanx 5, okay. And Brittany, staying with you, how should we convince hospital administration to buy this newer technology since you've had such a good experience?
Really, there's kind of a two-pronged approach to that, is looking at the cost benefit, really getting that return on cost with interoperability and a seamless workflow, reducing the time it takes for the nurse to be at the pump and more at the bedside is huge. And the other thing that really helps is that safety feature. Everybody in healthcare is got the goal of taking the best care of their patients in the safest environment. And that was a big seller for our administration, is that we would be able to present with them with the safest technology out there.
Do you have examples of outcomes related to efficiencies in workload, patient safety, or cost? I know you said that you're still working on the ROI from a quantitative standpoint, but do you have any other outcomes you can talk about? Since you're very early in implementation, we appreciate that.
Yeah, one of the examples we have for just ease of outcomes is heparin. With our older pumps, we were having to do a lot of manual calculations, and a lot of times the nurse, are having to go between the MAR and the book and the order set and doing the math and getting another nurse to do the math. And of course that takes a lot of time. And with this new setup, we're able to have it all just program right in. You can double check it right there. It gives you everything you need at your fingertips, as well as parameters. You can see right on the pump, like what's safe and what's not.
I guess let me see, I don't know which one of you want to take this one. Are all EHRs accepting of smart pump documentation?
I'll give it a try.
Okay.
I think it depends. It depends because there are some EMRs that are familiar to this audience, probably the Epics and the Cerners or the Meditechs, which are probably about 80%, if not 85% of all U.S. hospitals use one of those three EMRs. It's when you start using an EMR that hasn't really thought about integration at its core, or maybe a homegrown EMR that doesn't have the capability, again, basic fundamental capability built in. So it really depends. And so I would presume the majority do who are on this call, but there are always the outliers that we would have to investigate very closely to see whether the capability is existent in the EMR that they use today.
Great, thank you. One of our audience members wants to hear more about pump programming. Is it all through wireless connectivity? And if that's not completely up and running, is it done manually on the screen?
I'll take that one. I think it's from what I can gather from the question, it might be about interoperability. And in this case, if you're interoperable, again, those providers' orders actually program the pump for the clinician. So when you are at the bedside and you're doing barcode meds administration, you would add the scanning of the pump as that third item in the BCMA process. And in doing so, it makes that association. And again, the pump and the EMR talk with each other, and the pump is programmed based on those orders. If you do not have, of course, interoperability today, certainly manual programming should be kind of the second way to program the pump. But clearly, to keep medication errors low and to standardize the workflow, their interoperability is your holy grail where you want to get to. But manual program is a second alternative if necessary.
Even if the integration features and some of the interoperability features aren't fully implemented, can next generation pumps actually reduce time and steps for the nurse? Because we know that's really important, isn't it?
Yes, I time is one of our most valued assets as a nurse. Mm-hmm. And there is a lot of evidence coming out in the market today that talks about the next generation pump and how they are decreasing time in programming. And as I mentioned in this webinar, when you decrease the time in programming, it has two benefits. Number one, it decreases the chance that you'll be interrupted while programming the pump. And that's often where mistakes happen. And of course, it also helps you reduce the likelihood of bypassing the patient or the pump's safety software. And so those are the benefits of why you want to keep time and those steps in mind as you're programming and look at the most efficient way to actually program the device.
So, Sue, when you were discussing the guidelines for next generation smart pumps and the three pillars that you highlighted and noted, and the automate pillar, you noted how newer pumps can shorten interoperability implementation. How does it do that? How does it really shorten it?
Yeah, so think of it as if you were building a brand new house today. Your new house would be up to the latest code, latest standards, with the most, up-to-date, plumbing and electrical and heating, cooling, etc. The same thing with infusion pumps. The next generation pumps are really built with interoperability in mind. We know 3 out of 4 hospitals want to go up on interoperability in the next 3 to 5 years. And if you're thinking about that from the ground up, you're likely to kind of, the capabilities in hand to do it more effectively. So you want to decrease the time in which you, adopt interoperability. You want to make sure your testing is automated, because testing is a big component of interoperability during the implementation phase. So every element of that implementation needs to be kind of shortened, tightened, more, using technology that we use today to make sure it's, it's structured and standardized and it's done quickly.
Thank you. Brittany, back to you. Did San Luis Valley use the ADT feature before going interoperable, or did you just go directly to interoperability?
We currently use the ADT feature before going to interop, yes.
The answer is yes. Is having the web-based software helping not only nursing, but what about the impact on pharmacy and biomed to help getting real-time infusion data?
It is really nice to have that sort of software. So pharmacy, if they need to make a change to something, and especially right now in this climate where there's so many drug shortages, and sometimes they can only get in what they can get in, they're able to make a change to the drug library, and within 5 minutes, all of the pumps are updated, and there's none of this like having to run around and manually like get the pumps that update. And so it's really nice.
That just reminds me of something that you were both emphasizing during the webinar: make the right thing to do, the easy thing to do. And that's what it sounds like. Brittany, staying with you, is your team valued seeing the hard, soft limits visible right on the screen while programming? What do they say?
They do like it. It helps, especially in those areas. Sometimes if you're giving a medication that you're not terribly familiar with, or that is new to you, if you're a new grad and you're like, this is your first time giving it, you're able to just right there on the pump know, well, I'm getting close to the soft limits, or I'm getting close to the hard limits, and going out and seeking either other advice or talking with your physician and saying, hey, we need maybe another layer of medication with this, because I'm getting close to my limits, instead of having to constantly go back and find either your reference online or in the book to see where I should be at. It's been huge.
So to both of you, can the pumps be used manually in terms of programming in the event of downtime?
Yes.
Dreaded downtime we've all experienced.
They should, yes.
Yes.
I think if the device isn't built that way, it's not built the right way. So I would hope so. And Brittany, you can give your experience of that.
Yes. So we're in a small rural community, and we have a lot of different power surges and outages. And so we sometimes have some downtimes that come at us unexpectedly, and we have no problem at all. Everything still works seamlessly, even in downtime.
So Brittany, here's a question from SSM Health. Not getting into specific names of vendors, but how many different pumps did you evaluate when you were looking to go to a smart technology type system?
We looked at 4 different companies. We had them all bring in their vendor reps and demo for us. We had different groups of people. We had both bedside and administration kind of look and see which ones would best fit our facility.
So you really did usability testing at its best. So those that had to use it, and the administrators that had to oversee the purchasing process?
Yes.
That's one step that sometimes is not done, is usability testing, so that the front line is involved in the decision making. And I think you said it took about a week to train the nurses and the teams that had to use the technology?
With the hands-on, yeah. We had the online training out for about a month, and then hands-on training integrated in for about a week, and then we were able to get everybody up and running. It was really pretty seamless.
Terrific. Well, Sue and Brittany, I want to thank you for an informative conversation about smart pump technology. To our audience, if we were unable to get to your question, please email us at webinars@healthcommedia.com. As a reminder, this webinar will be available on demand at myAmericanNurse.com. Thank you, everyone, for joining us. Bye-bye.